Welcome to Health Reform 2.0, the only place on the internet for people with a curious mind and a desire for a better healthcare system. Here we take you on a journey of our current quagmire, tell you where it came from and why the government can't fix it. Along the way, we'll tell you some history, bust a few big myths, tell you a few stories, and give you an idea how we can work together and get the healthcare system we want. Let's get started. Hey, ladies and gentlemen, and welcome to Health Reform 2.0, Episode 1D. 1D as in David. Today's episode is entitled Women to the Rescue. That's Women to the Rescue. We are fortunate in America to have women for a lot of reasons, and today we're going to discuss how women have done a lot to save health care more than one occasion. And as usual, I'm joined by my partner, Tim Henning. Tim, how are you today? Welcome to the show, and what are we going to talk about?
Hey, Tom. How you doing today?
I'm doing good. How are you?
I'm doing great. Enjoying the nice, wet, stormy weather that we really needed here in Northern California. Hopefully, it'll help us with our drought situation.
I feel like I'm sitting up in New England, actually, with the rain dripping off the trees, a little bit of a fog over the hills, and the dampness just all over everywhere.
We had to cancel an MRI installation today because of the weather. It was too dangerous. Had to be lifted in with a crane, and the winds were too gusty in a snowstorm, so that's been put off. So it's the weather up there. I think this is their fourth nor'easter so far this year.
Yeah, I think so. It's been a wild year on the East Coast, and thank God we are in California.
Yeah, they're getting hammered pretty hard back there.
Yep.
So last episode we talked about the patent medicines. Selling the cures. It was a very interesting segment. Well, we're going to talk a little bit more about that, I think, forever, because it's still with us today to a certain extent. We also talked about the establishment and rise of the American Medical Association, the AMA, and their ability to take control of the state licensing of physicians, which, again, is still with us today and also affects the insurance carriers. So today, this episode, we're going to cover 1900 to 1930, the Progressive Era and its aftermath. So, Tom, what was the demise of patent medicine?
Well, Tim, at the turn of the century, kind of as we started to talk about at the last episode, America was in a crisis of addiction. Patent medicines were everywhere. The Proprietary Manufacturers Association was fully in control of the media, and America was just truly fully addicted. We talked in the last episode about the addiction rate then and the addiction rate now, and it was significant. The biggest issue, again, to bring to mind is that the people in 1900 did not know what was in any of the medications that they were taking and had been taking since the mid-1800s. For 55, 60 years, they had been taking cocaine, morphine, alcohol, and combinations of all of those things in one drug or another to cure everything. Just about any disease you had, there was a patent medicine to cure, and many of the patent medicines, as we said in the last episode, cured everything. In fact, even the venerable Sears and Roebuck catalog offered cocaine in a syringe for $1.50 in its 1890 edition. The term of the day was inebriant, and the thing that we would call today drunk was inebriety. And there was a journal of inebriety that was published from 1892 to 1903. It was one of many temperance pamphlets, and the Pharmaceutical Association and distributor papers at the dawn of the 20th century estimated 15 to 25% of the population was addicted to alcohol, morphine, cocaine, and any other number of narcotics. Today, the number has been estimated by various people to be as high as 30 to 33%. And again, the term of the day in general was inebriant, and the action was inebriety. The term reflected that the role that people of the day felt was personal choice played in addiction. They believed if you were addicted, it was a matter of personal choice. Inebriants were considered to be immoral, derelict of character, and the downfallen of God in most of the pamphlets that you read of the day. The term alcoholic and alcoholism emerged in the middle of the 19th century, around 1940 and 1950. But it was almost a century later before it would be seen as a medical condition. At the turn of the century, habitual drug users were either morphinists, cocainists, or dope fiends. And there was something that happened in this era that got a very important group of people's attention, the women of America.
Well, this is an interesting topic because, as you know, this past Saturday was St. Patrick's Day.
Indeed it was.
Did you happen to go downtown and take a look at the pubs and the bars that day?
I didn't go to downtown Danville. I was downtown in Campbell, California, meeting some friends of ours that night for dinner early, and they were all at a pub. And as you know, I can't drink anything anymore. And the pub was full of wannabe Irish people who were imbibing in their national holiday, whether they're Irish or not.
Oh, I think that's what this day's all about. But one thing was clear. There was a lot of people inebriated. So you talked about Samuel Hopkins Adams. The research we've looked at and the things I've read, he was a pretty big influence on all this when he wrote a number of articles. Can you explain who he was and the impact he had?
Well, something happened to get a very important group's attention, the women of America. In 1905, a writer named Samuel Hopkins Adams wrote a series of articles in Collier's Weekly detailing the addiction that was gripping America, and he pointed the finger of addiction directly at the patent medicine makers, the Proprietary Manufacturers Association.
That's interesting, Tom, and the comment about women is very important here. We've been in healthcare our entire careers. We opened women's health centers. We were involved heavily in that. And the women have a major stake and a major influence on what happens to the healthcare in their homes, much more than the men do.
And often, Tim, the bad health in the house affects a woman disproportionately, or women in general disproportionately, to the men in the household.
Yes, that's what the data suggests. So this is an important period of time because the shift started to happen here. It seemed to have had a lot of effect from this Samuel Hopkins Adams. Can you explain a little bit more about who he was and what he did?
Yeah, Samuel Adams was a muckraker, which was a term that came from that period of time. Muckrakers were newspaper men. They caused all kinds of problems. They were journalists who uncovered fraud at the turn of the century, focused on waste and corruption. In fact, many journalists today think of themselves as the defender of the people, and they're going after the rich and powerful and looking for fraud, waste, and corruption. And it is people like Samuel Hopkins Adams that really started that trend in America. It didn't exist before that. And the rise of national magazines in association with the rise of people like Adams, magazines like Collier's Weekly and McClure's helped give exposure to these scandals that didn't exist before. And they were competitive to the newspapers of the day. And these national magazines became a way for other people to get their word out that wasn't being controlled by the powerful media of the newspaper, which was mostly controlled by the patent medicine men and the robber barons. But Adams, for his part, exposed the addictive nature of most of the patent medicines. His articles illustrated the danger of these drugs and the hypocrisy of the men who defended them. He was able to establish clear connections among the various members of the patent medicine cartel and show how they had conspired to evade the public accountability. Perhaps most importantly, Adams revealed the shady business practices that the cartel employed to control the nation's newspapers, the supposed watchdogs for the public good. In one of Adams' articles, Collier's printed verbatim a quote by Frank J. Chaney, the president of the Manufacturers Association, at one of their meetings.
So this is interesting because at that point in time, the real media was the newspapers. They controlled everything. Today we have so many more outlets, and thank God for the internet. Some good, some not so good. We're able to get more information much faster. Just we have to filter that information. So this brings to mind some of the modern day muckrakers. Would that be a Ralph Nader? Would that be Julian Assange? Would that be anyone today that's exposing some of this graft and corruption? And is that today's whistleblower?
Yeah, well, it kind of is a whistleblower in a different way. It's really more and I this is not meant as an aspersion on any of the people that we have in the media today, but this would be a Rush Limbaugh, a Sean Hannity. They would be considered muckrakers in that period of time. The guys on CNN that go after Trump constantly, all those people that are out there that have these violent opinions about others and spend most of their time trying to uncover some wrong that they supposedly did. That's what muckrakers did. Whistleblowers of that day, yeah, they were whistleblowers, but they weren't whistleblowers the way we define it, working inside a company, exposing the problems that the company is producing. In fact, it was President Theodore Roosevelt, Teddy Roosevelt, who gave journalists the muckraker name. He complained that they were not being very helpful to the country because they spent all their time raking up every bit of muck they could find. And that was where the term muckraker came from. And it's really kind of still sticks around today. We don't necessarily use it as much as we used to. But we have a large percentage of our media today would be classified as muckrakers, I think.
Well, I think the term today would be used something more in a more profanity type of context, in my personal opinion, based on what I've seen.
Yeah.
And you can formulate your own words from that particular term.
I think you and I, having breakfast on occasion, have used a few of those words.
Yeah, a few times.
Yes.
So in our research and in your book, a very interesting piece, run across this guy by the name of Frank Cheney. Now, we don't know if he had any relation or if Dick Cheney has any relation to this guy. We need to look that up. But can you tell us who Frank Cheney was and what impact he had at the time?
Yeah, well, Frank J. Cheney was the manufacturer of Hall's Qatar Cure. We talked about Hall's in one of the last episodes. He was also president of the industry trade group, the Proprietary Manufacturers Association of America. Now, while addressing his fellow members at the annual meeting of 1899, Cheney made the following statement. He said, "We've had a good deal of difficulty in the last few years with the different legislatures of the different states, I believe. I have a plan whereby we will have no difficulty whatsoever with these people. I've used it in my business for the last 2 years, and I know it's a practical thing. I, inside of the last 2 years, have made contacts with between 15 and 16,000 newspapers and never had but one man refuse to sign this contract. And by saying to him that I could not sign a contract without this clause in it, he finally signed it. And this is what I have in every single contract that I make today. I have a clause that says the following. It is hereby agreed that should your state or the United States government pass any law that would interfere with or restrict the sale of proprietary medicines, this contract shall become void." Now, as an example, in the state of Illinois a few years ago, they wanted to assess me, Frank Cheney, $300. I thought I had a better plan than this, so I wrote to about 40 newspapers and merely said, "Please look at your contract with me and take note that if this law passes, you and I must stop doing business as my contract cease." The next week, every single one of those newspapers had an article opposing that bill in the legislature.
So, again, clearly things haven't changed. When you talk about the red clause, it was 1899. Today, I thought maybe it had to do with the election and Russian collusion, but I think that's a different thing.
That's a different red clause, I think.
Oh, yeah. Okay.
Yeah.
I was going to coin something here differently, but it looks like that's not the case.
Yeah.
But in your book, you also reported that the group had contracts you just mentioned with over 14,000 newspapers at the time. And I believe that earned them revenues of over $20 million per year from that industry. That's a pretty hefty sum in those days.
Yes, it was. And you got to remember that the patent medicine was the number one source of revenue in that era. They owned or controlled over 80% of the newspapers of the day. But as I said earlier, the weekly magazines were a very different story. At the same meeting as Cheney made that comment that made its way into Samuel Hopkins Adams, another gentleman that was a member of that association, Dr. Frank Humphreys, and he had a product called Pond's Healing Cream. Today we know it as Pond's Cold Cream, and the healing has disappeared. He said that the 20,000 newspapers of the United States make more money from advertising proprietary medicines than the proprietors of the medicines do themselves. He said of the patent medicine manufacturers' receipts, 1/3 to 1/2 goes for advertising. And then adding an almost sinister air to the proceedings, the records showed that Humphreys was concerned about what the public would think about this blatant form of manipulation of the press through the Red Clause. Humphreys actually said on record, "Will it not be now just as well to act on this, each and every one for ourselves, instead of putting it on the record? I think it's a good idea, but I don't think we really want any of this to be written down in the proceedings."
Well, of course not. And a good thing they didn't have tape recorders back then.
Yep. Or C-SPAN.
Or C-SPAN. Yeah. So the 1905 Adams had a comment on the effect on the populace. Can you elaborate on that a little bit?
Yeah, Adams made a comment about the population, and he said that they needed to restrict the drug by the same safeguards when sold under a lying pretense as when it flies in its true colors. Then and only then will our laws prevent the shameful trade that stupefies helpless babies, makes criminals of our voting men, and harlots of our young women.
So, Tom, let's talk a bit about ethical prescriptions versus over-the-counter patent medicines. How did this come about, and what was that? What was the mainstream behind that?
Well, the main thing behind that was the Collier's Weekly articles and Samuel Hopkins Adams, who now had written a series of articles over a number of months, specifically written to get the women upset, was having its effect. And the constant barrage that was hitting the women of the nation woke them up, and they started to significantly increase the pressure on the government and America to deal with the inebriety that was crippling the country.
So, Tom, the AMA had been such buddies with the patent medicine men and industry. It's interesting that they started to change their position, and I think that was driven a lot by the muckrakers and the women, because the women
Right.
had a big effect on this.
Right.
So in 1918, the AMA published its first article in JAMA against a certain patent medicine. What was that patent medicine, Tom?
Well, that patent medicine was Tyree's antiseptic powder. And one of the most interesting things of that period of time is about a year before, the AMA had been supportive of Tyree's antiseptic powder. They had actually been advertising it and written a series of pro articles about how good Tyree's and other antiseptic powders were for the public and were for people that took it. But the Journal of the American Medical Association started to feel the pressure from women and from society and the problems that were starting to happen with the patent medicine men. There was some laws that were coming into effect that were targeting cartels and targeting the patent medicine men and were being applied to them. So they had to come to a decision about their prior partner. At the beginning in the 1860s, the three associations were like three legs of the stool. You had the AMA, you had the Proprietary Manufacturers Association, and you had the National Pharmaceutical Association. And those three associations were working hand in glove at that period of time. But as patent medicines got further and further under fire, the AMA had to start to figure out what they were going to do. And one would hope that they had made the decision because it was a moral decision, that morality won out over economics. But in the end, they actually made the decision to go against the patent medicine men, because they also woke up and realized that back in the early 1800s, when they had apothecaries, a pharmacist had to write a prescription, which meant he saw the patient to do a diagnosis before he wrote the prescription, and he got paid, and then the prescription went to the apothecary who filled it. If they went back to this world where they had so-called ethical pharmaceuticals as opposed to patent medicines, the pharmacist would go back to writing a prescription, getting paid for that visit, and then the apothecary, or now pharmacist, not druggist, would go compound or fill that pharmaceutical, and then the doctor made money and the pharmacists again were making money. And that was how the world of ethical versus patent medicines. You had patent medicines on one side and ethical pharmaceuticals on the other. That is how that world started to change. That was the beginning of the end of the patent medicine era.
So our research shows us that the patent medicine men didn't go down easily. They didn't go off into the night, correct?
That's correct. That's correct. You're exactly right.
So they fought tooth and nail. So at this point in time, a very disturbing thing enters the fray. And I see this more than I like. And I will say for this podcast and anybody else that we will not tolerate any kind of racism against anyone. But something happened at this point in time that was very important. It was an article written by Joel Blanc in The Practical Druggist. I'm not sure what year it was, but this particular article had a profound effect in what was going to be the future of patent medicine and woke up a nation. Can you explain that?
I can. And again, to add to your kind of front end admonition, we are going to use the N word, but we're going to use it in the context of the day and the article. And again, normally Tim and I don't use the N word and we don't tolerate racism. But in an article representing what was now becoming the preeminent view that was being pushed forward by the Proprietary Manufacturers Association, this article appeared in 1905 in the Practical Druggist magazine that Tim referred to, which was a magazine produced, as you can tell, by the Proprietary Manufacturers Association. And it carried the offensive title, The Niggers in the Woodpile, and the author again was Joel Blanc. It made a mighty attempt to play down the whole problem of the rising tide of concern about addiction and the problems of patent medicines. The root of the problem, according to Joel Blanc, was the fiends who were abusing the harmless medications, not the manufacturers of the drugs. In effect, it was a user problem, not a manufacturer problem. And the Proprietary Association developed a technique of targeting minorities as the cause for any related issues. It had a long history in this patent medicine trade of doing this. In fact, we still see this in one form or another today. Blame the messenger, blame the user, don't ever put blame back on the manufacturer. But during this period, the blame was not directed to simply the poor classes. It was now seen repeatedly in newspaper articles, often in the South, where it began to attribute the concern of rising violence and rape of white women by addicted Negroes in the South or in the West as an expected outcome due to the unscrupulous nature of the Chinamen who were preferring opium all over the place. This article by Joel Blanc that hit was one of a series of articles that really started to try as a last-ditch effort to define the problem not as a problem of patent medicines, but truly a problem of the kinds of people that were abusing the drug.
And don't we see this every day? And I looked at this, it's brought up another important point we're going to get to when we get to the war on drugs. The same thing happened and continues to happen. We blame the user, and we can talk about that today in this whole opioid crisis we're having. And we have a whole series coming up on that. We continue to blame the user. And I don't think our war on drugs has been that effective. So I think this is a disturbing time. It's unfortunately a black spot in our history, one that we're not proud of. We're going to have more on this as this whole thing unravels. And we bring up really the women's role in the demise of patent medicines. You want to talk a little bit about that, Tom, and how they affected this in a profound way?
Yeah, and again, it's women are what changed America's addiction habit, and women started the fight against inebriation, particularly for alcohol, in the late 1800s, in 1880 up through 1920. Women had a major focus on fighting inebriation and addictive drugs like cocaine, morphine, and alcohol. And the temperance movements that started to happen early on, obviously we talked about the temperance movement in Atlanta, Georgia, which was one of the reasons that we now have Coca-Cola today. It because they had to get the alcohol out because the temperance laws started to pass. But it really takes us forward and shows that it was women and their concern about how their men were behaving, mostly on cocaine, morphine, and alcohol, that started to push them forward. But there was another interesting fact, that the majority of addiction was not the men of the era in terms of morphine and cocaine. Men were highly addicted to alcohol, that's true. But much of the cocaine and morphine addiction of the day was in women who were seeking some method of dealing with their monthly menstrual cramps. And they were dealing with opium and cocaine that was being sold widely all over the place. I talked earlier about Sears and Roebuck. It was available many, many places, and it was often the cure for women. So not only were women fighting for the reduction of inebriation in the men that they had to live with, and remember, women didn't have those rights they have today. And secondly, they were fighting their own recognized addiction in drugs like cocaine and morphine of that day.
So this addiction issue has been with our country for a very long time, probably from the very beginnings. And it continues, as you can see from the opioid crisis that we look at today. What we'd like to get to next, I think, is the nursing practice. So Nurses to the Rescue is the title of this section. So in the history of nursing profession, it's as colorful as any other field in our early American medicine. In the early days, they were used in hospital warehouses for the dying. And we talked about the early hospitals. You mentioned this many, many times in previous episodes. They were a place that you went to die. They were for the insane and the people that were dying. Most people that could afford it had physicians treat them in their homes. So hospitals were a different thing back then. Now, nurses back then were typically men, some men, and women serving punishment for some reason, being confined. Nurses were often prostitutes and other incarcerated female criminals. They were the bitch servants of the doctors. Happily, things have changed, maybe. But I can tell you from experience, not in all cases.
That's true. And Tim, what's interesting about this is doctors and nurses have had contentious relationships as long as you and I have been alive. And there's been a push-pull between the use of nurses and nurses' abilities to succeed and do more medicine, and the resistance of the AMA and doctors from allowing nurses over the years to have any role in practice other than patting the patient on the back, going to pour out a little bit of medicine, or maybe applying a Band-Aid. And the primary reason was the control over the money flow of medicine and having no one be an usurper to the throne of the high priest of healthcare, which is the way the AMA viewed the role of allopathic physicians. And nurses presented early on a significant threat to that. And as you and I have aged and seen the evolution of healthcare, nurses have risen from just being the people that kind of clean up after the patient and doctor and do a few things that the doctors don't really want to be involved with doing, to having a very effective role in healthcare.
Yes, see that. And I have to say that things have changed pretty dramatically. I remember being in the provider market, working in hospitals back in the 70s, early 80s, and it was really very disturbing to see the way that nurses were treated, at least in the place that I worked. And I found it degrading, and I found that the doctors at that point in time had this certain air about them. This they could do no wrong, an arrogance. They got away with a lot of things. Fortunately, that's changed dramatically for the good. We have a long ways to go, but the nursing profession has changed so much in the course of our national health care.
It's true. Yeah, it's true. And the other thing is in the past 25 or 30 years, you've noticed that nurses have elevated in their performance. I now have nurses routinely giving me injections. I have nurses that are doing a number of other things. There's now physician's assistants, which is women are now involved in being physician's assistants, which was to carry the nursing role, I think, to the next level. And while we think it was a way to elevate nurses, I would also counsel that the contrary is also true. Creating an additional role that required a lot more education and a lot more expense put an artificial barrier between the role of a nurse and the role of a physician by creating this middle ground that said if you really want to spend a lot more time and become a PA, well, then you can do even more things that a doctor does. But this idea of licensure as a restriction to the performance of medicine is often really built more to preserve the economics of the person whose role is higher in the process than it is to actually protect the public. I think you and I can attest to the fact that often nurses have a much better understanding of what's going on with any individual patient than the doctor does because they've spent much more time with the patient. They've spent a lot more time finding out about what's going on. And in many cases, they have a very good ability to diagnose what's actually happening.
So, Tom, both you and I go to the same medical practice out here. I haven't seen the doctor that owns the practice, there's two of them actually, in over probably 8 years. I see the nurse practitioner, I see the PA, I see whoever, and I get great care, and I never have to worry about anything. And actually, they spend time,
right,
which is great. So again, it's interesting the economics because we mentioned before that for every 5-10 minutes that a physician or any person that's going to be charting spends with you, they're going to spend 15 to 20 minutes charting because that's
right,
how the bills are paid.
right.
And so that's another topic about the efficiency of a medical practice these days. And it's going to become more and more demanding on them as MACRA and a few other things kick in, which we'll talk about in the future episodes.
Yep. Yep.
So I just want to reiterate that nurses have contributed so much and will continue to do so much more. And women have contributed so much to our history of the advancement of healthcare in the United States.
And I think both Tim, you and I speak the same way. We think that as healthcare evolves, the role of nurses is going to have to be expanded if we're going to find a way to have effective and affordable care. We can't take the highest priced person in any given practice and feel that they have to treat every possible disease that walks in the door when most of the diseases coming in neither have effective treatment or are easily and readily identified from a diagnostic process. Nurses do a very, very good job of understanding what the day-to-day things we face are that don't necessarily need significant intervention, and we should be able to empower them to deal with most of those things and not have to have, again, the most expensive guy in the office diagnosing a common cold. Or not diagnosing the common cold is a better way to put it.
That's right. It doesn't matter anyway. Nothing you can do about it. One more point. Been watching a lot lately with a great deal of intensity these ads that come on TV. And I will submit to you that 90% of the ads that I see are directed and tailored for the female population. It's evident when you see these things and the way these people are masters. The people that do the marketing for these healthcare providers, for the drug companies, they're very good at what they do. And if you take close attention to these ads and the messaging, it's directed to the women.
Yeah, I think most of it is. They're the decision makers for care. Most men ignore care
Yep.
and would prefer not to deal with it. It is the woman in the household that makes the man go so she can protect her husband, her supporter, her whatever, her partner in life. And they also take active roles in making sure their children grow up to be healthy. That's not to say that men don't worry about their kids and men don't worry about their wives. They do. But the women in society have always been the ones disproportionately affected by bad health and have also been the ones that have stimulated improvements in health because they are the one that carries the burden when health goes awry.
Yep, my wife keeps beating me over the head about the colonoscopy. I guess I'll have to cave in someday.
I got a really small video camera if you want to borrow it.
I think I'll pass.
All right, very good.
All right, so let's move on to another period. On September 14th, 1901, President William McKinley was assassinated and Vice President Theodore Roosevelt assumed the highest office in the land. The roots of progressivism were in the 1890s, prompted in part by the excess of the robber barons. Teddy Roosevelt's election marks the true start of the progressive era, which is surprising that he was a Republican. This led into the formation and approval of the 1906 Pure Food and Drug Act, better known as the Wiley Act. Can you tell us what this act did and what its effect was?
Yeah, the Wiley Act was a federal law that was put in place to require that certain specific substances, including anything containing alcohol, cocaine, heroin, morphine, and cannabis, had to be accurately labeled with the contents and recommended dosage as well. It had to be on the bottles of all patent medicines. All the addictive substances continued to be legal in over-the-counter sales as long as they were properly labeled. Nonetheless, it was estimated that the sale of patent medicines containing narcotics decreased by about 1/3 after this labeling was mandated.
So, Tom, did this lead to the current FDA?
Yes, but it took about 24 years to really get there. In 1933, remember, we passed the Pure Food and Drug Act in 1906. But it took to 1933 to get the next Roosevelt, which was Franklin Delano Roosevelt, FDR, who is Teddy Roosevelt's cousin. He modified the Wiley Act and gave it some real legal legislative bite. Yet despite real enforcement provisions for violations and a robust FDA now coming into being, it took them till 1963 to finally eliminate patent medicines from the marketplace.
So the legacy of the 1906 Act includes federal regulation authority over 1/4 of the gross domestic product and is the market gatekeeping power over human and animal drugs, food, preservatives, medical devices, biologics, and vaccines, correct?
Yeah. Well, once again, it was women that stimulated yet another change to our health regulations. A touring show called the American Chamber of Horrors helped illuminate the deficiencies in the old 1906 Act. It was launched in 1933 with a book called 100,000 Guinea Pigs by Arthur Callett and Frederick Schlink. A U.S. Food and Drug Administration, which is now the FDA, put on an exhibit to illustrate the need for a new law. The wife of Franklin Roosevelt, Eleanor Roosevelt, toured with the show to help elevate the status of the problem as public relations tool. She showed jars with deceptive labeling and packaging, which in the case of jarred chicken, hid dark meat that was jarred in deceptive containers, which seemed larger than they actually were. And it included examples of harmful drugs, including a product called Banbar that was a cure for diabetes that protected under the 1906 law, and Lash Lure, an eyelash dye that caused many of its women users to go blind. Also legal under the old 1906 law was Radiator, a radium-containing tonic that sentenced most users to a slow and painful death. This, along with some other court cases, caused the FDA to focus on replacing the now outdated Wiley Act of 1906.
So this led to a number of other legislation that we're going to just touch on briefly, because I think it's important for people to really understand a lot of things that were put in place and what really the effect was or what not the effect was. Well, the first one that comes to mind is the Sherman Antitrust Act of 1890. Can you help us understand a little bit about what that act was and what it was supposed to do?
Yeah, despite its name, the Sherman Antitrust Act, it had really very little to do in actuality with trusts. It's often seen as applying to busting up Standard Oil, and it was used to do that. But it is, in fact, a law against monopolistic business practices, and at the time, trusts were popular vehicles for monopolists to evade trading fairly in the marketplace. And according to one contemporary account, the Sherman Act's goal is not to protect business from the working of the market. It is to protect the public from the failure of the market. The act was meant to prevent cartels and other entities from damaging free competition. Nowhere in our history has this been more necessary than during the patent medicine era. The prime motivation for the law's passage was to break the back of monopolies like the Standard Oil Trust, the railroad cartel, and to ultimately weaken the market control of the Patent Medicine Proprietary Association.
So, Tom, you mentioned in the previous episode the Miles Medical Company. Now, this comes up again here in this Antitrust Act. What happened between them and John D. Parkinson's?
Well, the case of Dr. Miles Medical Company versus John D. Parkinson's was actually the first major case prosecuted under the Sherman Act. Dr. Miles had sued Parkinson's because they were freely discounting his product in violation of the contract that he had with them. This case went all the way to the Supreme Court, which ruled in 1911 in Park's favor. A majority of the justices agreed that Miles' contracts were unenforceable since their resale price enforcement provisions violated the Sherman Act. This milestone ruling would set the precedent for prohibiting manufacturers from setting minimum retail prices for the next 100 years. Now, Miles did go change the wording of his contracts, but continued to try to sidestep the law. Patent medicine men in general became very adept at obscuring the price paid by purchasers through various schemes like SPIFs, which stands for Sales Performance Incentive Fund, rebates, and market development funds. These are the same schemes that proliferate today as a way to effectively obscure price and cost. And they actually are one of the biggest problems in why we can't effectively count what healthcare costs in America.
So, as I mentioned before, the patent medicine men didn't go down easily, did they?
No, they did not. They hung around for quite a while.
So this brings us to 1914 and the Clayton Act. And again, targeted at the abusive behavior of the patent medicine industry.
Right. And the Clayton Act was really targeted at prohibiting specific types of conduct that weren't deemed in the best interest of a competitive market. So the Clayton Act targeted the abusive behaviors of the patent medicine industry, and it did it by specifically prohibiting certain types of conduct that eliminated competition in the marketplace. Primarily, it sits around having price discrimination between different purchasers of a product. It doesn't so much affect the retail price of the product, but it does affect the distributor price of the product, because distributors now get different prices based on the volume of product that they buy. But every distributor that buys at a certain volume category has the right to buy at the same price within that category. And you cannot, under this law, have a category of one distributor. So one guy can't get a really extra special deal and you freeze everybody else out. But the other side effect of the Clayton Act was that it set up a series of laws that govern mergers and acquisitions that allow the government to test whether there's still going to be a competitive market after that merger and acquisition. So we see it today. The SEC now does the investigation of this, and we're seeing it right now with this potential Chinese acquisition of Qualcomm, which the SEC has come back and said, look, we don't think that that's a good idea because it's going to create an effective monopoly in the U.S., therefore barring the Chinese from actually buying Qualcomm.
So this brings a point that I'd like to expand upon, because this particular act and a number of these different things were put in place to keep monopolies under control doesn't appear to be applying to healthcare. And let me explain that.
Yep.
So if you look at the current situation in healthcare and you look at any mergers and acquisitions, these healthcare providers, what we call large IDNs, are consolidating. And the whole attempt is to lock that market down to get favorable pricing from the payers and develop scale.
Right.
We've seen it in many different areas. It was a merger between Providence and St. Joseph's Health, now possibly Ascension Health. The deal with the former CHW, which is Dignity Health, with CHI. The list goes on. And if you look at the current publications, there was probably at least, last time I counted, 8 to 12 negotiations going on
right.
around continued consolidation and continued growth of these IDNs. But I've not heard one word, except in one case, where anyone stepped in and challenged the monopoly of this particular practice.
And it's real difficult to challenge the monopoly of a practice because these laws were written in a day and age when products were physical products. And if you read the laws, they're all contrived in a way that is looking around actual sale of a physical product, not services. The problem with trying to productize services is you can package a service and say, here's what you get for your dollar, and you get these 4 things I'm going to do. But by and large, services tend to vary based on things that go beyond just a physical one product. I buy a bottle of water, it's a bottle of water. But if I have you come dig a well at my house, your cost of digging the well is going to be based on the depth of the well, the problems you run into digging it, etc. And you can use the same analogy for medicine. So it's very difficult in medicine to go after pricing because there's just the argument that it's different for one doctor and another doctor, that the pricing may vary because it's different. Now, we know, you and I know, that the reimbursements are being set based on the procedure that's being done or the diagnosis that's being done, and that's being set by insurers taking their cues off of Medicare, and that was an attempt to try to bring this down to getting some level of price control. In fact, there's been arguments that say that that kind of price control actually violates the same laws we're just talking about. The government really doesn't have the right to come in and say to you, you can only charge $5.50 to give an injection. They can say, we're only going to pay you $5.50 to get the injection, to give the injection. But the doctor, it's kind of hard for the government to restrict a doctor from charging more. And if you look at the laws haven't really been the things that have stopped doctors from charging more. It has been the contracts they have with the insurers. And the insurers set these things that said best and final payment. And when the insurance company paid the doctor, historically under contract, the doctor was not allowed to go back to the patient for more, with rare exceptions. So the problem in pursuing monopolies around service-based businesses is that it's not a physical product, and therefore it's really hard to get down to fix a price. You can have a monopoly in a service-based business. It can happen. But the test of that monopoly really gets down to when there's really significantly only one player that people can go to get the service.
And I think this has been the cornerstone of why these particular schemes are not working as people thought they would.
Right.
As we limit the amount of access, the theory would be that I can improve my standing with the payers and therefore dictate. We still see that, but in many, the practice hasn't stopped.
Right.
And it's not just the mergers of large IDN institutions. It's the corporate practice of medicine of buying up physician practices and putting them into the foundation model here in California specifically.
Right. Right.
You are told what you're told what to do by
right.
the corporation.
And aggregation of purchasing has happened in numbers of industries through a variety of ways, getting purchasing power to get a better discount. And that's actually fully legal under the law as long as there's not some rate that only one group can qualify for. But the problem in healthcare is that picking up another 1 or 2 percentage points of margin on the goods that they're buying is going to make or break the difference in a practice. And it's just not the case. The problem in healthcare is a costing problem. And if you look at the aggregation that has been going on in the market for the last 7 to 8 years, you and I were not long ago in Washington, D.C. talking to a doctor in West Virginia that was aggregated right out of business. And around that time, you and I did some work, and we found out that the average value of an aggregated physician to these groups that were buying up all these secondary markets and consolidating these practices was a loss of $175,000 per year of physician. So bringing them together innately actually ended up costing these guys aggregating more. And the most interesting thing about the aggregation thing is they're still doing it because they don't have another way to solve the problem, and that is not going to work.
Very true. The list is a mile long. So there was a lot of acts in 1914. There was the Harrison Narcotics Act. What was that?
Well, that was a first federal law to deal with the problem of narcotic addiction directly. And in 1914, there were hundreds of thousands of opium addicts in the U.S. Some men who frequented opium dens operated by Chinese immigrants. 3/4 of them were women. They were there seeking relief from menstrual cramps. Women would obtain opiates through prescriptions by physicians or pharmacists or buy them through Sears and Roebuck catalog. And the Harrison Act forced manufacturers and distributors to register with the federal tax collectors and pay a special tax on the sale of opium or coca leaves, their salts, derivatives, or preparations, and for any other purposes. And the courts interpreted this to mean that physicians could still prescribe narcotics to patients during normal treatment, but not for the treatment actually of addiction. So it was an interesting act, and it just, in the long run, it didn't really play out very well.
Much like the next act we're going to talk about. And we're not going to go into detail here, but we will in a later episode. I think we could devote an episode to this. And I'm going to invite Cameron Riley and Ray Harris on that did 3 episodes on this particular topic. Their podcasts are very good, by the way. Look them up, Cameron Riley and Ray Harris Jr. So in 1919, the Volstead Act was passed, prohibition. It didn't work so good. So by 1925, there were between 30,000, 100,000 speakeasy clubs in New York City. So I guess that law kind of is like the same law our marijuana laws are today. It didn't work so good.
That's right. And the by the time the Volstead Act passed, what people forget is that many states had already enacted various temperance laws. We spoke about the Fulton County law that passed that forced what we now see as Coca-Cola to come into the marketplace. The effect on the laws on the patent medicine industry at the time was limited. In fact, the Cullen-Harrison Amendment provided a medicinal use exception to the law that actually gave patent medicines a boost during what was the industry's period of general decline. So if you couldn't go out and buy alcohol to drink at home, you could buy a medicine that was mostly alcohol, like Geritol, although Geritol came many years later. And again, remember, it was temperance that had been the long drawn-out main fight that women had fought against inebriation beginning in the 1860s. But on December 5th of 1933, the ratification of the 21st Amendment by the states repealed the 18th Amendment, and the U.S. law still prohibits the manufacture of distilled spirits without meeting numerous licensing requirements, and it makes it impractical to produce distilled spirits for personal use today. When I was growing up, there were a number of people that lived around me in the southern part of Maryland that did produce their own alcohol for their personal consumption and private sale on the side. And of course, they had the Internal Revenue Service called revenuers that came down from time to time to try to get these guys. So I wasn't born in the 30s and 40s, but even in the 50s and 60s and into the 70s of Maryland, there were moonshiners producing moonshine alcohol in the county that I lived in Maryland.
Oh, it still goes on. There's a TV show I happened to be flipping through that was called Moonshiners. It's today's moonshiners, and they have an actual reality TV show about moonshining.
Yep. Well, it's we can have a show sometime talking about my experience running into some of these things in the woods when I was kids, and some of the people that lived around and what they did. It was still is an interesting part of Americana, I think.
Well, it's no different than when I go out in the woods up at our place in the mountains. I'm very, very careful when I'm in areas that I don't know about looking for tripwires and looking for different things, because it exists today, let me tell you.
Well, you can smell a still a quarter mile to a half a mile away. It's got a very pungent aroma, believe me.
Yeah. You can't smell the marijuana, though, unless they're smoking it. So,
yeah, that's true.
It goes on and on. So, because those that were rich and can afford alcohol just stacked up on alcohol.
Right.
They put it in their cellars and kept it, and they had their alcohol, and they knew this was going to go away at some point. But there were the other poor, misfortunate people that didn't have that capability, and that led to another degree of really a class warfare, if you would, a racism twins to it, because of the fact that many people could not afford to stock up on alcohol and turned to other means to obtain alcohol.
True. And also the problem for the poor in America, particularly in areas that have a lot of moonshine being produced, is twofold. Number one is it was cheap, an effective way to escape the problems they had on a daily basis, which is one reason that it was so addictive. It was easy to get a hold of and served a very good purpose of oblivion. But the other problem is if you're poor and you don't have a lot of income, it's like the coca farmers down in Colombia. You know, it's a ready source of money. And if you're trying to provide for your family and survive, many people went off and made this a way to get into business and make money and survive. In fact, without going into any details to embarrass anybody, there were some families in the county that I grew up in that gained pretty good prominence, and most of their early days and early access to money came as a result of making moonshine.
You wouldn't be talking about the Kennedys now, would you?
No, I would not. But, you know, there's another story right there.
There's a whole other story right there.
And there are hundreds of stories across, or thousands of stories probably across this country, of families that made their first money, started towns, became the founding fathers of towns, but they made their first money by doing things like selling patent medicines, creating moonshine and other forms of hard-to-get items that may have been illegal at the time or not readily acceptable to the marketplace. And we talked about history being elastic, and it's because today we don't live in a world that has the same things that they had. We don't have the same pressures. We don't have the same lack of opportunities. So they did what they needed to do to support their families and survive, and it's easy for us to look back with these morally just and right eyes and damn them for the things they did. That's not saying we should promote the things they did, but we need to recognize that hindsight may be 20/20, but when you live in the day you live in, you have blinders on every day. Some of them are alcohol-induced, some cocaine-induced, some laudanum morphine-induced, and you know, it's easy for us to sit and look back, but we have to recognize that history is a good thing that we can learn from as long as we open our minds to understanding why and how they lived it.
Bingo. It's about learning. Unfortunately, most people don't.
Yep.
So we're going to wrap it up here. We're going to pick it up again on the next episode, which is entitled "Physicians' Rise in Power." And this is the period of time that I believe we'll see the expanded role of the physician. We're going to see many new developments. And, I think we're going to see a growth in hospitals and once again talk about the AMA.
Exactly.
So we'll pick that up here soon. I hope everyone enjoyed the podcast. Any last thoughts before we wrap it up today, Tom?
Yeah, the basic thing is to say to everybody once again that, we are enjoying bringing this to you. We hope you are enjoying it. Please feel free to send links in our emails that we send to you out to others and help us increase the people coming to hear what we have to talk about. And, we appreciate everybody listening to what we have to say, and we hope you're enjoying it. And one last point is that if you have a question that comes up that you'd like to get an answer to, send it to us at info@hr-20.com. info@hr-20.com. Send us your question, and we might make a show about it. So we really appreciate you guys listening to us, and we hope to see you on the next one.
So long, everyone.